A study is conducted to determine the efficacy of a new drug used to prevent obesity. 1,000 participants in a normal range for BMI are randomized to a treatment or control group. A year later, BMI data was collected and the results were as follows. And we have a table here showing the treatment and control groups and BMI above 30 and BMI below 30. 500 in the treatment group and 500 in the control group. 50 of the treated had BMI above 30, so therefore 450 had BMI below 30. Control, 100 of them had above 30 BMI, so 400 of them had below BMI of 30. Which of the following values best represents the absolute risk reduction for obesity when taking this new drug? Choice A, 0.1, choice B, 0.44, choice C, 0.5, choice D, 10, or choice E, 50. I'll wait 5 seconds and answer the question. So this is just a very easy biostats question. I mean, it's pretty much a definitions question because it's just straight up asking you what the absolute risk reduction is. And you need to know that absolute risk reduction is essentially the quote unquote raw amount that the risk has been reduced after you've given the treatment. So in this case, we have 500 total people in each group, the control group and the treatment group, and 50 of the people treated had BMI above 30, whereas 100 of the people who were in the control had BMI above 30, which means the absolute risk reduction is 100 divided by 500 minus 50 divided by 500, which equals 50 divided by 500, which is 0.1, which is choice A here. Like I said, very easy definitions and arithmetic question essentially. So let's look at some of the wrong answer choices here. Choice B, 0.44. This is the odds ratio, which in this case would be 50 divided by 450 over 100 divided by 400. Usually when we're talking about odds ratios, we're talking about case control studies. Choice C, 0.5. This is a relative risk, which in this case is 50 divided by 500 over 100 divided by 500. Relative risk is the measurement we use mostly in cohort studies. Choice D, 10. This is the number needed to treat, which is 1 divided by the absolute risk reduction, which we already found, which is 0.1. So reciprocal of 0.1, 1 divided by 0.1 is 10. As the term implies, number of needed to treat is the number of patients you need to give the new intervention to make a difference of one patient. So, for example, for this experiment, it means we would need to treat 10 people with this new drug before we have a balance of one extra person with no obesity as compared to the control group. Choice E, 50. This is just the raw difference between the number of obese subjects in the control versus experimental group, which is 100 minus 50. Not a terribly useful calculation on its own. So bring it back, you just need to know some of these biostats definitions. Absolute risk reduction, it's basically just the raw amount that a risk has been reduced, as the name implies, which basically is you take each group and you take the number of positives divided by the total amount of people in that group, and then you find the difference between those two values. I hope you found this video helpful. I'll see you in the next one.